A shell company changes hands. A million identities silently move across a spreadsheet. Claims fire through Medicare at machine speed. Catheters, braces, monitors. None of it ordered by you, most of it never delivered. Federal agents call it Operation Gold Rush, a multi-billion-dollar scheme unlike anything they've seen. Tonight we follow the money. All defendants are presumed innocent until proven guilty. What Gold Rush really was. In late June and early July 2025, the Justice Department unsealed indictments that prosecutors say expose a $10.6 billion durable medical equipment scheme, part of the nationwide healthcare fraud takedown that charged 324 defendants connected to $14.6 billion in alleged losses. Investigators say the Gold Rush network used stolen identities and foreign straw owners to acquire dozens of legitimate Medicare-enrolled DME companies, then blasted out fraudulent claims from the inside. Authorities estimate more than 1 million Americans had their personal data compromised. Here's the twist. Officials say over 99% of Medicare payments tied to Gold Rush were intercepted before cash went out, thanks to real-time analytics and rapid freezes. But supplemental insurers, who auto-pay coinsurance after Medicare, still paid about $1 billion before the pipeline was shut. That's why this case matters. It shows what data-driven defenses can stop and where the system still leaks. Gold Rush wasn't a sloppy telemarketing ring, it was corporate control. Prosecutors say the organization bought already approved DME companies, entities with existing billing privileges and clean histories, then installed nominee owners to hide the real leadership abroad. With the keys to the billing portals, the ring allegedly submitted billions in claims for items like urinary catheters and other DME that patients didn't order and doctors didn't prescribe. The power move wasn't faking a single invoice. It was capturing the front door to Medicare's payment system. If you're new to DME fraud, here's why this works. Once a DME company is accredited and enrolled, the operational friction is low. Claims can be batched, documentation can be spoofed, and if you're sitting inside a legitimate supplier profile, basic filters don't always see you as an outsider. That's why investigators track identity overlaps, ownership changes, and claim velocity, not just codes. Gold Rush, as described in filings and reporting, hit all three. How the identities flowed. According to the indictment and media reporting, the network allegedly stole or traded PII for over 1 million Americans, patients and clinicians, and used that data to populate orders, certificates, and delivery records. Think about the churn this creates. Patients receive explanation of benefit statements for gear they never saw, doctors see their names on orders they never signed, and small plan administrators drown in calls. This isn't just financial waste, it's identity abuse at scale. Prosecutors also allege Gold Rush rotated ownership of the DME companies through foreign nominees, creating the illusion of ordinary business activity. The goal? Buy time, long enough to fire off claims in waves. When analytics flag one entity, the control shifts to another. It's a shell game, but the shells are real Medicare suppliers. The numbers that shocked everyone. Gold Rush sits inside the larger 2025 National Healthcare Fraud Takedown, the largest coordinated action of its kind, with 324 people charged, including 93 medical professionals, and more than $245 million seized in cash, cars, crypto, and property. Officials say the actual losses, money that left Medicare Medicaid, stand near $2.9 billion, a fraction of the $14.6 billion intended loss across all cases, because data edits and fast action stopped much of the cash from leaving. Those two numbers, intended versus actual, explain why you see enormous headlines but smaller final payouts. The system's defenses are getting faster. And yet, supplemental payers, commercial policies that automatically pay the leftover portion, took a direct hit in Gold Rush for roughly $1 billion. That leak matters to families. It raises premiums and distorts risk pools, even when the federal program dodges the transfer. The data fusion shift. Officials say the government stood up a healthcare fraud data fusion center, a hub that blends claims analytics, identity signals, and law enforcement intel to freeze flows in real time. Instead of waiting for auditors to reconcile quarters later, analysts trace ownership webs, device SKUs, NPI clusters, and shipping patterns as claims are submitted. That's how in Gold Rush, most payments were blocked before money moved. Think of it as an always-on ledger radar that watches for abnormal velocity and network overlaps. It's not just math. The center coordinates seizures too, so if proceeds hit a merchant account or crypto wallet, partners can move to freeze and recover. That's where the 245 plus in asset seizures across the 2025 takedown signals something important. Speed now decides whether a massive conspiracy becomes a massive payout. In the Eastern District of New York indictment, what comes Gold Rush? 11 defendants are charged with conspiracies related to healthcare fraud, wire fraud, and money laundering. Prosecutors allege a transnational organization based in Russia and elsewhere orchestrated the purchase of DME suppliers. These are allegations using nominee owners, and the government still must control intent, knowledge, and fraud in court, while blasting billions in claims. Names and counts are in the public charging documents. Some defendants were arrested, to the national others picture remain abroad. The DOJ's takedown spans 50 federal districts plus state media tallies note 25 charges touching telemedicine, among nearly DME, 100 medical genetic tests charged, and drug diversion. The scope is how you cut through the noise. This is organized, international, and fast. The human angle for patients, the damage isn't always until visible. An insurer questions a real one later. You don't know your clinician ID was used until a pharmacy calls about a refill you never wrote. Gold Rush shows how identity misuse becomes a second crisis. Calls, letters, hours fixing records. And for honest providers, network contamination can trigger audits and payment holds that cost time and staff. This is why fraud cases matter, even when most money was blocked. The administrative harm still lasts. 3 signals viewers and caregivers can watch for patterns early. Delivered but not requested DME, braces, catheters, supplies on your doorstep. 2. EOBs for strangers, charges for a device or test you never discussed. Ownership churn, letters or calls from your medical supplier with a new name every few months. Call your plan's fraud line and HHS-OIG. Save every notice and do not ignore EOBs just because they say no payment due. Those documents are your paper trail. Why Gold Rush changes the playbook. Gold Rush reveals the new frontier, not spoofed prescriptions from a garage, but corporate capture of legitimate billing channels. The fix won't come from one silver bullet. It will be ownership vetting, real-time analytics, provider education and patient vigilance, plus prosecutors who can follow the proceeds across borders. The national takedown shows the architecture is in place. Multi-agency work, data fusion, fast seizure authority, 99% Medicare payments public blocked, charging documents supplemental that help the rest of us learn signs. Fraudsters buy billing privileges, alleged 10.6B Gold Rush scheme. A data fusion center, rapid freezes, 245 plus, seized nationwide during the 2025 sweep. If this breakdown helped you see how Operation Gold Rush worked, subscribe to Med Finance True Crime. We break down medical fraud, insurance scams, and the financial trails that expose them. No gore, just facts and analysis.